Do you often feel unusually tired, get dizzy when you stand up, or suddenly crave salty snacks? These everyday clues can be the body's way of saying that something is off with the adrenal glands. In secondary adrenal insufficiency, SAI, the pituitary gland, the manager at the top of the hormone chain, stops sending the proper signal ACTH to the adrenal glands, so they don't make enough cortisol. Without enough cortisol, you may feel weak, have low blood pressure, and struggle to cope with stress, much like a factory that slows production when the supervisor is absent. What could cause the pituitary manager to stop giving orders? Common reasons include pituitary tumors that press on or damage hormone-producing cells, surgery or radiation aimed at the brain or pituitary that unintentionally harms the ACTH-producing area, long-term use of high-dose steroids like prednisone for other illnesses. The body gets used to the external steroid, and the pituitary slows down its own ACTH production. Head injuries or infections that affect the pituitary. If you have had any of these, ask yourself, did my doctor ever mention checking hormone levels after treatment? Notice any of these everyday signals. Persistent fatigue that does not improve with rest. Weakness especially in the legs or arms. Feeling light-headed or faint when you stand up quickly, orthostatic dizziness. Craving salty foods or feeling a sudden urge for extra salt. Nausea, loss of appetite, or mild weight loss. Low blood pressure that you can feel as a thin pulse. These symptoms are often vague, so they can be mistaken for stress or a cold. A simple self-check. If you skip a cup of coffee and still feel exhausted, that is a clue to look deeper. How do doctors confirm SAI? The process usually involves blood tests, measuring cortisol levels in the morning, and after a CTH stimulation test to see if the adrenals can respond. Pituitary imaging, MRI, to look for tumors or damage. Review of medication history, especially past steroid use. Treatment is straightforward. Hydrocortisone tablets, a synthetic cortisol taken daily to replace what's missing. During illness, surgery, or major stress, the dose is temporarily increased, called stress dosing. Think of it as giving the body a short-term boost, like adding extra fuel when you're climbing a hill. Regular follow-up with your doctor ensures the dose stays just right, not too low and not too high. Explanation: can you lower the chance of developing SAI? Yes, by being proactive. Use steroids only when necessary, and follow your doctor's tapering schedule carefully. Never stop them abruptly. Get regular hormone checks after pituitary surgery, radiation, or long-term steroid therapy. Report new symptoms early, fatigue, dizziness, salt cravings, so they can be evaluated before they become severe. Maintain a balanced diet with adequate sodium, especially if you're already low on cortisol. Think of prevention as routine car maintenance. Regular oil checks keep the engine running smoothly. What's new in the world of Psy? Recent advances include modified release hydrocortisone formulations that mimic the body's natural cortisol rhythm more closely, improving energy levels and sleep quality. Better biomarkers like salivary cortisol that allow at-home monitoring of hormone levels. Genetic studies helping doctors predict who might develop pituitary problems after radiation. Digital health tools, apps that remind patients to increase their steroid dose during illness and log symptoms for clinicians. These innovations aim to make management more personalized, so you can feel more like yourself every day.